of Behind the Bite, a brand new series that we are starting in the dental space. And I am pretty excited because I am joined by a wide range of panelists that are going to help us discuss today's topic of why the dental industry struggles with employee benefits. So, with that being said, I don't want to waste any time. We've got a lot of juicy questions to ask our panelists. So let's just kind of start going around the horn and do a quick little intro of everybody. Since Caro was the first in my upper left-hand corner, we'll let her go first, and then we'll skip it over to Rhonda.
Awesome. Well, thank you, Cody. I'm excited to be here and excited for this series. I'm Kara Kelly. I'm the CEO and founder of Clinical HR, and I am a fractional HR business partner for dental practices. And if you don't know what that means, it means I am a strategic advisor. I'm not a payroll button pusher or a recruiter. I do expert compliance and then advisory, helping them with their people problems.
Perfect. Well, welcome. Rhonda, over to you.
Yep, my name's Rhonda. I'm the Chief Health Innovation Officer with Welltrio. Nurse by trade, started this company about 11 years ago. Super excited to find out what we can do and understand about the dental industry in this podcast. Thanks, Cody.
Perfect. Thanks. And then we'll kick it over to John, and then we'll just kind of go from John to Dan and go all the way over to the last John.
Who's the first John? Me?
Yeah, we'll go with you, John, since you're the cool one with the hat on.
Right on. So, John Montoya, I'm a practicing dentist for 25 years, also the CEO and founder of Dental Purchasing Partners, which is a group buying organization to help private practices save on their overhead.
Perfect.
And then
Jake?
I'm Dan Johnson. Me and my brother actually have 4 dental practices in Central Texas. And then I'm also the CEO and founder of Peak Performance Virtual Assistants. So we help dental offices with all the back end stuff through virtual assistants, like outside the office help. So.
Perfect. All right, Jake, we'll let you go.
Jake Goetz. I am the co-founder of Dental School, where we're helping to host this podcast and make sure that it gets out to everybody. And then I'm also the CEO and founder of GOAT CMO, which is a fractional chief marketing officer organization to help practices optimize their marketing money and stop wasting it where it's not getting them a return.
Nice. Lovely. All right, John, bring us home.
Hey, great. My name is John Knutson, not to be confused with the other John. We got double Johns here on this show. I'm the owner of Knutson Benefits Group. So here, just talking about all the insurance benefits that we can offer small businesses all throughout the country. So I've been at this for 21 years and love what I do. Love helping out businesses, trying to find creative solutions to a pretty nasty problem. So hoping we can dive into some good ideas here today.
Perfect. Well, thanks to all of you guys for joining. We appreciate it. As I mentioned before, this is our first episode of this new series, so we're kind of excited to see where we can take the conversation. And for those that are listening in, if you want to participate in the conversation, feel free to drop your comments in all of the various channels that we are broadcasting to as well. We'd love to get those up on stage and have our panelists answer those for you. So with that being said, let's just dive right in. From some of the studies that I've been looking at lately, it looks like there's been roughly about 89% of dental practices are now starting to offer employee benefits. And, with that being said, since 2021, the premiums have almost hit double digits in the amount of premium rate increases per year. And so there has been a real love-hate relationship when it comes to the dental industry and the employee benefits itself. And so, with the dental industry spending more and more money to solve problems of retention and recruiting top talent to their dental practice, it seems like things are flat or even getting worse. And so my first question to the panel is, why is this happening, and what is actually the root cause of the whole love-hate relationship that the dental industry has with employee benefits? Anybody can jump in if they have anything they want to say.
I can tell you from having 4 practices, for us, it's the cost, like, and trying to find the right employees that want to stick around, and then offer them the benefits. You know, with us having 4 practices and having 42 employees, the cost can be very substantial. And we're heavy PPO, about 80% PPO, and where we struggle in our practices is, you know, we can only get reimbursed so much from the insurance companies, and so we can't raise prices. We can't, and so when prices increase in other areas, it puts a squeeze on on us in the practices, you know. And so I think for the traditional PPO, maybe smaller group or even individual practices, to have that extra expense, it does create some burden. Not to mention the cost of wages have gone up. I always tell people, you know, I might hire somebody at $25 an hour, but as a business owner, we have to look at, yeah, you might be $25 an hour, but then taxes, so you're at 33. Oh, and then you want benefits, so all of a sudden you're a $45 an hour employee that the business is eating, but the employee only sees that they're a $25 employee, and so it makes that relationship seem one-sided. Now, I'm a big believer of your employees are your greatest asset, you know, to help you grow and continue. But also you have to protect business. And so that's kind of where, and for us personally, that's where we always struggle with, hey, is this something good for the business? Because we try to do what's good for the business, what's good for the patient, and what's good for the employee. Those are the 3 kind of aspects we try to follow in our practices. So for us, that's why benefits can be very hot, cold subject for us personally and for employees.
Right. Okay. Anybody else have anything they want to add to that question?
Yeah, I mean, along the same lines, like everything in the industry right now is going up, and benefits included. And so you've got to find margin if you're going to be adding things to your employee benefits package. And employees, you know, they're gone are the days where you're just hiring a salaried employee. I mean, I think they're getting smarter, and rightfully so. I think the employees deserve to have, you know, health, 401k, all the benefits, but that comes at a cost to the business owner. And if you don't have that built into your overhead structure, you're not able to pull that off. Or it's going to come out of your pocket as a business owner. And honestly, nobody wants to pull money out of their pocket, even as much as they love their employees. You know, that's a hard thing to do. And so there's got to be a little give and take. And Dan's exactly right. The employee doesn't see the extra expense going out the back end of the office to provide those benefits. They just see the hourly wage. So I think as employers, we need to do a better job educating and saying, hey, you know, you are getting, you know, this per hour, but, you know, here's all the back end benefits that you really are getting. So your wage is Y and not really X. And then as business owners, we do have to kind of shop around and look to see what's the best. And you know, there's some programs out there that are great and some programs that are out there that are marginal. And unfortunately, you don't just want to spend money and say you have a benefit. You really want to put the right things in place, and that's also a hard thing to do. Yeah.
And can I echo a little bit what John was talking about, of like finding the right plan? I think that's another thing. Since we work in the dental industry and we see what insurances can and can't do for patients, I think sometimes that's also that where he also mentioned education is I think we as owners need to be educated a little bit better on what's available and what is actually out there, because we've been burned a lot just through patients dealing with insurances, all the back end stuff that we have to deal with for patients. And so I think education would be a good key even for the owners to understand, okay, what's good, and then we can also educate our team as well. So I think it kind of goes from what's out there, educating ourselves, and then educating our team.
I'd also maybe add that the education is also a realignment of expectation. You know, if you go back 20, 30 years where all of these amazing successful practices were operating and taking home 40, 50, 60, whatever percent as profit, they were doing that because they were misclassifying team members as 1099 and not giving them benefits, or they were saying, well, I don't want to give you benefits, so I'm going to make you part-time. And it was okay for some of them because you had a predominantly female workforce. A lot of them maybe had kids at home and they wanted to have more of those part-time hours. And so it was fine. They didn't need health insurance because they got it through their spouse. Well, now their spouse's company, because there's been a shift in the insurance industry, I'm sure y'all are aware of, where a lot of insurance companies are saying, well, if your spouse that's on your plan has insurance or has access to insurance, we're not going to insure them. And so they're having to sign forms every year saying that this person doesn't have access. And so now that when they do, all of a sudden they actually need to get it through your company. And so that's really putting a burden that was not historically there on the practices now, in addition to the fact that the reimbursements aren't increasing, although everything else is.
Yeah, no, that makes
But I
sense.
guess another thing that I'd like to add is that if you're looking into putting benefits into the practice, any business for that matter, you have to realize that those benefits are going to be there for eternity. Because you can't take away those benefits,
Yeah.
after they put in place, or you're going to upset a lot of your employees. So you have to kind of look at it as a long-term plan. Like, okay, well, I'm going to add 401k and there's going to be a matching, like that's going to be in place from the time you put that in till you retire, sell the practice, whatever your decision is. So look at the numbers, look at the figures and say, can I afford this from now until I retire? Or can I add all of this at once? Because you're going to upset a lot of people if you say, well, yeah, we did have health insurance, but now we don't.
Well, and can I
So-
afford this for every single person on my team, regardless of whether or not they have it or they want it? I see a lot of practices make the mistake of, well, I only have one employee that wants it, so we're going to get it, and we're going to get this gold level, top tier, very expensive plan. And then another team member has a qualifying event, and all of a sudden that's an extra expense for the practice. They didn't really budget for what if everybody needs to be on it. And so then they end up having to pull back or going to a much, much worse plan. And then, yes, you're right, people get upset because they feel like that they had something taken away.
Well, I think that comes down to education, because I think that's, as owners, I think sometimes we think, oh, well, I'm going to put it for one or two people, but not realizing, like, once you do it, you open it up. You can't just open it for one or two people. Once you get it, you have to open it up to anybody that's eligible. And I think that's where some offices get in trouble, because they think it's only for one or two people, or maybe a couple doctors. Like, since we have a bunch of associates, and if we did just for associates, but then we have to open it up to everybody. And so I think that's where the education comes in for the doctors, realizing, like, if you don't do it right in the beginning, you could set yourself for some serious hurt later on.
Yeah.
Hey, Cody, let me chime in here too. And this might be a little bit shocking to some. I mean, I'm an insurance broker by trade, right? But to answer your question, why is this happening? Why is cost going up? Why is it becoming so unaffordable? The reason is the insurance companies. That may not, and again, you guys are, you're dealing with it from a little bit of a different angle. You're seeing how an insurance company operates by way of them dealing with you on your claims. I got to tell you, in my time, I've seen enough. I'm getting a little bit disgusted by it, actually. Insurance companies, I feel, are taking advantage of the marketplace right now. They are. Sometimes we use a real estate analogy when we're talking about it, because it feels a lot like the way that I operate as a landlord. I have a little duplex, okay, and for my renters that are renting from me, I increase their rents every single year. Why do I do that? Because I know the neighbor up the street just increased their rents. And yes, it's true that I think expenses, it'll cost more to replace my roof in the future than it does today, and maybe for that reason I increase rents. But honestly, the reason I increase my rents on my tenants is just because I can. And I'm seeing the exact same thing happening with insurance companies. They're coming out realizing that you're going to take your renewal. If it's a 9 to 12%, you're going to go, wow, at least it wasn't so bad this year. I know some people that had 30 or 40% renewal. Give me any other industry where a 9 to 12% increase in your cost is normal or even celebrated. I'm kind of getting sick of this whole game, and we're trying to get out there to say to employers, it doesn't have to be that way. You don't have to rent your health insurance anymore from a landlord style insurance company. You can own your own health insurance plan. You can take control of it, and when you do that, you'll be able to control those costs a lot better moving forward. So I've seen these insurance companies play with their renewals and adjusting things and wheeling and dealing. It's just disgusting. You'd almost see downright criminal in some cases, but it's wild.
Well, and then
Well,
to
I've
the
always
dentist. Oh, go ahead. Go
I was
ahead.
gonna say, I told my brother sometimes like, man, I think we went in the wrong industry. We should have started a dental insurance company, because like you said, it's just
It's
you can deny, and
yeah.
keep
It's
raising in. So
funny.
that
It's funny, Dan, because I go to these insurance company meetings, and they sit there as the insurance company, and they play this horrible, sad song about how hard it is for them, and boy, claims are getting really expensive, and yet you look around and you're like, I name up on a billboard. Okay, those aren't cheap. We're sitting in this like immaculate office space. I'm going, okay. I'm seeing that you're spending a lot of money where you can, and then you have other players entering the market. If it's so bad, how come we have a lot more insurance companies now than we did 10 years ago? It's
yeah.
it's because they're making money. They've figured out that they can really turn a profit. So yeah, we're saying, okay, enough of this. We gotta peel back this. We gotta lift up this curtain and do it a better way.
Well, and as you can tell, John always brings the spicy takes, which I love. So
Sorry, Cody.
no, I love it. I love it. So no, this is great. And I mean, to what Dan and John just said, a second ago, they're kind of limited on their margins of what they can charge the consumer, and yet the insurance companies are the ones that are kind of increasing. So, with that being said, I mean, where do you start? If you want to control your costs, where do you really start in this whole kind of thing? And to your guys' points, it's you don't want to rob Peter to pay Paul type of thing. You got to make it so that it's a cash flow business for you, and that everybody, if you're going to offer benefits, is a good fit. But where do you start once you do start with those benefits? Because like I think it was John that said, once you start, you can't remove them.
Yeah.
So where do you start? And I guess I'll throw that question over to Rhonda. Like, that's what your team does, is you go in and do this kind of stuff for a living. So let's kind of talk about what you guys do.
Yeah, I do have a question. When you, in my experience, most dentals are independent practices. Are you finding that you have to offer benefits to be competitive and get the workforce that you need?
For us, I think it depends on what we found with trying to get high level hygienists is usually a must. But we found with our admin team, not usually. And so that's where we're in the conundrum of each of our separate offices are individual corporations. So we set them up separately. And so what we've done in a couple that we have done in others. And so trying to find that good medium to finding the right and good quality candidates or employees is always hard, because you have some that want benefits or they'll go somewhere else. And so for us, it's been, where's that balance? So I'm not sure how John is, but that's how we've been with our practices.
Yeah, we found that hygiene specifically. I mean, they're looking for a benefits package. Administrative staff, they're looking for benefits package. Auxiliaries, it's hit or miss. It really depends on their significant other and what they have available to them outside of the office. But I feel in our area, this day and age, 80% are looking for some sort of benefit, and specifically for us, it would be a retirement plan, and then health would be next.
Yeah. That's what I'm noticing as well. Is John's in a market that is one of the highest saturated markets of DSOs. So these DSOs are coming in and they're offering benefits packages where the private practice wasn't offering it 10 years ago. So more and more of these private practices are starting to offer it to compete for the DSOs. Because even though many in the private sector don't want to go work for a DSO, that's a very attractive offer if these people have been in the industry a long time and now they're a two household working, two member household that is in the workforce instead of just one, where they have to find a way to do that. And to Kara's point earlier, there's many of these insurance plans where they'll tell you you have to disclose if your spouse already has benefits somewhere else because we don't want to pay for them. And it's very interesting to see the shift that's happened. I was part of a really big organization before I went out on my own, and we had 60 employees, and it was a must. Like if we didn't have the 401k with a significant match and health and vision and dental, and it was all paid for by the employer in a market that was so saturated in dental and had so many big tech companies around us and other marketing agencies, we couldn't recruit anybody without a really significant benefits package. And so that was our go-to in the interview process. Was as a recruiting tool, we were telling people, oh, and our benefits package is worth $17,000 a year. And so, they'd look at that and go, wow, then I definitely want to come work for you. And I still sit on the board of that company. And if we change anything, we have employee turnover every time that we change our benefits package.
That's what I'm seeing.
I'm seeing similar to in private as well as in corporate practices, that the private practices are having to compete with the corporate. Some of them are able to do it in kind of a middle ground where they have a plan that's a health insurance stipend is kind of a step one, that the team member can go and find their own insurance, but that they have a stipend that they receive each month for it. I'm also seeing where they are having to do something to basically help solve what we're calling like the temping problem, where especially in hygiene, if they're not getting benefits, if they don't have this amazing culture that they want to be part of and have a team that really feel like they're supported and they're actually getting what the rest of the team is getting, because that's been a problem for hygiene for years, right? Oh, this is our most expensive employee, so we just don't want to pay them for their CE. We don't want to pay them PTO at the rate that they're supposed to get. I still have practices that will give hygienists a flat fee for holiday pay instead of actually paying them what their hourly would be for holiday pay. I see that from time to time. And so if you're not able to give them that, then for them, why are they there? Why not just go temp and make more per hour? They're not going to get the benefits anyway. They may as well make more per hour. And that's created this compounding problem that is hard for both corporate and private practice.
Yeah, makes sense.
Well, and I think that's why a lot of private practices and DSOs use organizations to find. That's why you hear a lot of AI coming up in dental and medical. You have that's why I started my virtual assistant company, to find ways to bring on contractors, 1099 employees that can do all the back end admin stuff, so you don't have to find somebody locally. Because during COVID, it was a nightmare trying to find just regular employees to, somebody to sit up front, or an assistant. And so I think that's why a lot of these other advances are coming along and thriving, because of the need to find other ways to protect margins and still employees or have people doing the back end or work for your office. Hygiene's a whole different animal. We've all seen hygiene. When I started 15 years ago, I think, John, we're probably about the same time. Hygienists were what, 30? I think my first hygienist we hired was $30 an hour. And now we can't find anybody we're in Texas, Central Texas. It's like $55, $60. I have some clients in New York, they're at $75 an hour for a hygienist, and then you're trying to get reimbursed from the insurance company for hygiene. You're like, wait, how can they even hit that production mark? And so it's just changing a lot.
And what's interesting is that from what I'm seeing, assistants are next. That's something they've caught on to. Because I do a lot of things like employee handbooks and I go through a lot of policies. I go ahead and build, benefits plans, not actually putting together the health insurance plan, but what are we doing for paid time off? Is it split between sick and this? Is it what are we doing for bonus structure? Putting all of this together, I'm seeing that they're having some struggles even retaining assistants. And so I go into some of these assisting groups as well and kind of follow the conversation. And that's where it's starting to go too, that we've got assistants that have learned that they can make more temping as an assistant. And if they're not going to be treated well at the practice that they're at, and they're not feeling like they're getting the benefits that they feel like they deserve, they are going to start going the same direction that hygiene's gone.
Yep.
Makes sense.
Yeah, I think Dan's business is going to explode here in the next several years. I mean, more and more doctors are turning to AI and virtual assistants and those sort of things to fill those spots. And it makes total sense to do that. If you can have somebody sitting at the front desk and they may get sick, or you have to pay them benefits or whatever, or you can have somebody sitting somewhere else and they're rarely take time off. You can pay them less. You don't have to pay them benefits. I mean, doctors are going to turn more and more towards that solution. And then, obviously I built my business around reducing overhead, because the private practice, I mean, they're like the fee-for-service dentist or fee-for-service patient of the dental industry, right? They're paying the most out of everybody, right? They may get 5% thrown their way, but the DSOs are getting 30 to 60% off of things. And so the doctors are going to need to figure out a way to shave in certain areas across the board. And one of them is with staffing, because it is skyrocketing. And Dan, I mean, you're probably in a golden age here to provide your services for offices, because we're going to need to do something. We're going to need to do something.
It goes back to what you're doing as well, John. Like when you, as my best friend Chad just signed up to John's program, and it was basically because John offers a high-end Invisalign thing where he gets discounted. And so doctors and officers are looking for these systems and these ways. It's like, I call it cutting the percentages. How do you find 1, 2, 3, 4, 5% in your practice that you can find ways to save money that traditionally we just didn't really worry about? We had enough profit margins. It wasn't a big deal. But now you're realizing, like, I have to find these 3 to 5% to compete not only with payroll costs, because in my practice, payroll is by far the number one highest cost. I mean, it's not even close. And so you still have to find those, supplies went up. Can't really do much with that other than finding systems or groups that you can get better supplies, because DSOs, when it's got 30, 40, 50 offices in a DSO that can get a better pricing than an individual practice, you have to find these groups like John's that you can actually go and compete. So you can find those 3 to 5%. And that's where a lot of the private practices, if they're smart, they have to do these type of systems to stay relevant, so they can actually pay hygienists, they can pay assistants, they can pay their team, and stay competitive with the rest of the market, or the DSLs will just kind of keep steamrolling.
Makes sense. I do want to circle back on something that John said. I'm going to extend a personal invite out to you, my friend, because one of the topics that we're going to have coming up is the power of AI and how that's going to all affect everything. So would love to have you come back on and discuss on that one, because AI is very powerful. It can save a lot of money, but we're still dealing with the health industry, which is, a lot of people love human touch. And so there's a great debate going on, and I'd love you to participate in that one coming up. But kind of circling back to what we were talking about before is, it does sound like cost is a big thing for the dentist, and we totally get it. I do want to kind of call out John and Rhonda, because John's got a unique cash pay kind of thing. And I know that some dentists, some doctors, some medical services out there do provide cash benefits, discounts for those kind of things. So, John, I'm just kind of curious if you want to share a little bit, and Rhonda, I want to circle back to you. Talking about like how you guys cut costs as well.
Yeah, I mean, anybody listening, and a lot of you here on the call too. I mean, if you've got a background in dental practices, you'll understand what I'm going to say. And it is that we have learned that that doctors, hospitals, clinics, they hate health insurance just about as much as anybody does. And similar to you in your dental practices, how many people do you hire and have to employ just to navigate all of the different insurance plans and knowing how to file a claim and how to go through that. It's just a hassle. There's a huge administrative load put on the entire healthcare industry just because of health insurance. So what we've discovered is that if you will approach a hospital, a doctor, a clinic with an upfront ability to pay them on the spot, ready to go, here's your payment, we'll send it to you right away, that these providers will deeply discount their services. Some people aren't aware of that. And usually, in order to get a cash discount, the problem has always been that you've had to tuck your insurance card away. You've never been able to have a health plan and still negotiate in cash. But we've got some exciting plans now that have cracked the code and figured out how to do it. So it is a health plan. It's 100% compliant. It passes all the Affordable Care Act compliance measures that we have now. These things are a 100% bona fide health insurance plan and will completely protect the employer, even if claims get into the millions. But they're doing it in a very interesting and creative way by offering cash payments up front to providers. And it is so it's if instead of having a bunch of ID cards, now they just have a debit card that is tied to the plan assets. So you still pay premium into this health plan, but now the premium that we have is being set aside to be negotiated and paid up front in cash. We're seeing some amazing results from this. Typically you go to a hospital, they sometimes talk about it as a percentage of Medicare. So if you're an older than 65-year-old and you're walking around with Medicare, then you would be paying 100% of Medicare in that scenario. Most people that carry around a traditional health insurance plan, United Healthcare, Cigna, Aetna, all these big names, you're typically paying around 400% of Medicare or 4 times the amount that a Medicare patient would. And when we approach providers with cash, we're finding that it's much closer to like 115% of Medicare. So we are saving hundreds of thousands of dollars by approaching these providers in cash upfront. And it's changing the way we think about health insurance.
So I started a company about 11 years ago to figure out how to do exactly what Dan, you talked about, which is save that 1, 2, 3, 4, 5%, and actually created a program where we were saving the company 60% on their healthcare costs. That's one of your many expenses, but when you can keep that flat or dropping instead of what John talked about, that 10 to 12% annual increase, and you call that a good day, like that is not a good day in my book. We want to be buying a plan, not renting a plan, and we want you to have your health insurance premiums go down year over year, not increase year over year, and offer that really competitive high-end benefit that attracts the employees and then keeps them, like customers in many reviews, say, I can't leave my company because of my healthcare plan. And that's the kind of benefit we want to put in place for all employers. Some of the plans that we work with John to put in place, depending on your geographic location, we can self-fund down to 3 employees. So especially with these dental groups where typically you need like 25, 50 employees to be able to self-fund and to buy that plan instead of rent it, we can do that down to 3 in some of these cash-centric plans. They're incredible. So really powerful tool for dental specifically.
Well, and I think it's also important, like I was talking about education, is on those plans. Like I'm big on HSAs, like attaching it where people can understand the importance of an HSA and what it can do for you long term, especially with our producers, our doctors, when they come out of school, because we have associates that don't understand financials long term, what things can do. And so those are like PPO plans with HSA attachments are things that I know we personally always try to look into and find, but just trying to find the right ones. Like we're in Texas, it's kind of PPO plan in Texas is brutal to try to find, especially individuals. So that's for us, it's just trying to find the right plans that can actually do everything that we want our team to do long term and what's really good for them, not just throw them on a plan that's really good for us and than just for us. So like for us, it's kind of a dual aspect of how do we make it good for us, but good for them as well.
Yeah.
Rhonda, I have a question for you. When you have these self-funded plans, do you typically find that the practices are covering 100% for the employee, or are they still kind of doing the 50 or 70? Because that's one of the things that I run into as an issue is maybe they've gotten an 18% increase, or say, hey, maybe it's a 10%. Maybe they had a good year and it's a 10% increase. It's an increase for the practice, but it's also an increase for the employee. If the employee is paying 30 or 50%, which means now the employee is taking home less and going and asking for a raise, because they feel like they're not taking home as much. And so the practice is not only having to struggle to cover the increase, they're also having to cover what the team members' increase is in the form of a raise or bonus or something. So are you finding that would be easier for them to cover 100%, or are you still seeing kind of a percentage split between the employee?
That was a great question. We really try to take the lead of what the dental practice for the client needs to do. Everyone's going to have a different ability based on budgets and what they have previously offered. In the pilot program that I started 11 years ago, that particular group had a 60% decrease in insurance costs and a 30% decrease to the employee. In the plan that John just talked about, that cash plan where you're buying instead of renting, the employee, that plan is a zero out of pocket for the individual. If the provider takes cash, it's covered 100%. So then the employee is maybe a little bit more willing to pay a little higher premium because they know that first dollar is covered when they get to the doctor, which is a huge relief to just in being able to budget for healthcare to the employee. So however the employer wants to set it up is how we're going to set it up. And then, but to create a benefit that has the ability to retain employment, to attract good employees, to be a benefit where the employees not only have it, but they're excited about it. Like if I have an intake call with an employee and they don't leave excited about their benefit, I've done something wrong. I do that education piece, Stan, that you talked about. If the company wants an HSA in place as well, we can do that. But with really these cash plans, it's covered 100%. That first dollar is covered. So there's just a lot of creative ways to work when you understand where to look, to work within the system that we have and make better choices and benefits for our employees.
Well, Dad, you also brought up you've brought it up, I think 2 or 3 times now, as education, right? And from my experience working with dentists in the past, they don't go to dental school to become a business major or marketing guru or an HR professional, right? They go to school to become a dentist, and so a lot of them come out and they struggle with this kind of stuff, and so that's why you got Jake and you got Kara and people like that to help out. For me, I think it really boils down to not only an education for the dentists and the practice owners, the DSOs as well, when it comes to the benefits, but I also think that it's an education for the employees as well. Because if you look at the benefits of it doesn't matter if it's in the dental industry or any industry at that point, the gaps that cause the increases on these plans every single year start with the employees making poor healthcare decisions. And what I mean by that is like going to an ER when they scrape their arm when they could have just called a telehealth nurse or even just gone to an Instacare for a fraction of the cost, or they go and they pay 7 to 10% over on their prescription for convenience versus driving an extra block or two to a different pharmacy to get their prescription. And so, that's kind of my next question is like, how do we educate these people? Because I mean, I'm looking at the dentist and a lot of these single practices, the dentist is the one that's filling the cavities, pulling the teeth by day and by night. They're trying to figure out how to do marketing, how to do HR, and how to do benefits and operations. There's not a lot of time, not enough hours in the day to basically educate yourself on what's available out there. So that's kind of my next question is like, how do you not only educate yourself, but how do you also educate your employees to make better healthcare decisions to keep your benefits and costs in check?
That one's actually an easy one for me. I'm a big believer you surround yourself with people that are better than you at things you're not good at. So if you're a clinician, went to school to be a doctor, you come out, you be a doctor, but be willing to put people around you that are good at things. And what I've seen happen is sometimes they'll get out and then they stop investing in themselves. So they stop hiring somebody like Jake or somebody that knows HR or these people that they bring on their team to help them do those things so they can focus on the clinical aspect where they're actually no dentist makes money outside the chair. Well, unless you have associates, but if you're a single practice owner and you make your money working on the chair, like in the chair, right? And so you have to put those people around you that know how to do those things and that can do it for you. And that's how, look at the DSOs. DSOs grow because they put people around them that know what they're doing and how they're going to do it and how they structure. And that's the key of growth and being able to do that for your practices and for your teams.
Yeah, I would echo that a little bit with.
Yeah, Dan is right. Go.
Oh, there's a weird lag. But one of the things that I would just echo that is in terms of how are you creating not only the environment of the people, like Dan said, but what is your workflow for communication so that you can learn from your employees and that you can share best practices. One thing that we did as part of one of our fast growing teams was we actually created a Slack channel in our team communication tool. And then we created a GroupMe with another organization that I was sitting on the board for. And it was literally healthcare questions. And we had every employee, as part of their signing on, understand that if they commented anything on that, the company was not liable for HIPAA of anything that was disclosed within that channel. So it was just, that was the attorney's red line that we had to put in there. But it became this really cool environment where you've always got a couple of coworkers that are dealing with a lot more health issues than others, and they learn. Like we were at the time, we were going through a baby in the NICU for 3 months, and we were getting pummeled with medical bills. And oh, our insurance doesn't cover that as a group policy. And I was pissed. Like I was like, what are you talking about? My portion is $600,000. Like, there's no way. And well, we covered X. And so I start peppering this audience of questions, and these few people start saying, well, have you called telehealth? Have you tried that for this? Have you tried this for that? And have you considered e-scripts and mailing in your scripts instead of going to the pharmacy locally? And before we knew it, we had learned all kinds of tricks on how to negotiate. And when I ended up going out and starting another business, to Kara's point earlier, I said, look, we don't have the capacity right now and the revenue to pay for benefits. So I'm going to give you a sign-on bonus that will cover your first year, and we'll reevaluate. But I want you to use that money, $750 a month equivalent. We gave her a $9,000 bonus in the form of a $750 stipend every month to pay for her own marketplace insurance policy. And we started our own GroupMe with just me and her when she was my first employee. And I said, whatever you need, let's just ask the question, and we'll use people like Kara and others who can guide us down this path to make the right decisions for when we will become eligible to start our own group policy. But just by creating an environment where you can have an open dialogue in a place where people feel safe and heard, even though you're admitting that you don't have all of the answers, you're willing to go and find solutions together. That can be a really powerful educational component to let you know, what do I need to have on my radar to look for as I continue to build a company and establish something that people want to be a part of.
Yep. John, I think you were trying to jump in there.
Cody, just something came to mind here. I was thinking that for anybody listening here today, I think maybe a great takeaway, something that all of you can take home and use and put into practice, is just start challenging the status quo. I would just be leery of people that are kind of saying that that's just the way things are, and this is the way it is, and your company's too small. Sometimes you get these pushbacks from people in my industry that make you feel like there's truly no other option out there. But I would just, for anybody listening, trying to do the best they can and trying to save where possible, just push back on guys like me, your insurance broker, whoever he is. Give him a call and say, hey, what's new, what's interesting, what's going on in the industry, what you know to do this better. How can we bring control over our plan and transparency over where the money's flowing? A lot has changed in my industry over the last few years, and if you're not hearing about it, you need to start getting educated. So push back, ask those hard questions, and if they can't answer them, start looking around and in your market, start looking around. Feel free to reach out to me. I'd even be able to help you and talk you through some different ideas. But it's time to push back. We need to start being uncomfortable with the status quo and looking for something better.
Yep. Kara, I'm curious. You do a lot of fractional HR for a variety of different clients, and are very, very knowledgeable in the space. I'm curious, when it comes to employee onboarding with enrollment, with benefits and things like that. Is that something that you cover, or is that something that you lightly cover on your end?
It's something that I help them build out. Anybody
Mhm.
that's working with me, especially if we're doing something like an ongoing compliance project. One of the things that I like to share when we're talking about onboarding is that onboarding is different than training. And I don't
Mhm.
think we invest enough time in the actual onboarding process, which, by the way, starts before day one. It's like day -14 is the
Yeah.
onboarding. And so educating them on what benefits are available, making sure you're making time to do that. I know that sometimes we're very desperate to have that team member there, and we just need them to get thrown into rotation and pick up the work and start working with patients and get productive as fast as possible. But if we're not taking a couple of days to let them actually absorb some information and go through the information that we have, make sure we're really giving them that dedicated time, saying, I am actually truly here to answer questions, not, hey, jot that down on a Post-it so that I can answer it while I'm in between my 14 patients this afternoon. Like, we really need to create that space. And what John was saying earlier, the things we've always done doesn't necessarily mean that it's the best way to do things. And so that is kind of the way we've always done it. And it shouldn't be. We need to create that space. And I know that means loss of production. I know telling a dentist to make less money that day is sometimes very difficult for them. You really do end up tripping over dollars to pick up nickels when you're not investing time to spend time with your team to really integrate them into your culture. And your benefits are part of your culture. It's part of your employee value proposition. So make that time and give them that education, that hands-on one-on-one, either yourself or whoever's leading your practice if you've got multiple locations. But yeah, I do help them build that aspect out because it is really critical, and it's more than just training and getting some paperwork done.
Perfect. Yeah, I want Dan and John, and anybody that's listening, to kind of walk away from what you've experienced. What has been one of the biggest frustrations or bottlenecks when it comes to their benefits and understanding their benefits to help the dentists that are listening in today maybe overcome that or reevaluate their process and their flow to help their employees feel more educated or even just up to date on what's happening.
Was that question to me?
Yeah.
Oh, sorry. I really feel like a lot of it's transparency. Like, truly, the team members don't know what makes up their total compensation or total rewards is what we call it in HR. And so giving them a actual spreadsheet that breaks down all of the things. This is really what it's costing us to bring you on. This is the value that you are to the practice. It's not just what you see on your pay stub or your W-2 at the end of the year. I think a lot of doctors, first of all, don't know how to break that out. And second, are concerned about breaking it out and don't want to put some of that information on paper. And they really should, because that's going to help them literally from day one. You can bring the new hire in, or somebody you're interviewing to bring in, and say, this is what somebody in this role made the last couple of years. Redacted, of course. Don't share personal, but this is the potential that you have to earn in this position. And this is what it was from 24 to 25 to 26. that we really do continue to invest in you, and we will continue to invest in you to the best of our ability. I think that's going to help make you more competitive as an employer, help them be more transparent and really understand the numbers behind things. And I think everybody on the same page is always going to be a win.
Perfect.
And can I throw a little? I'm gonna push back a little bit on more
Love
of
it. Bring it.
the office side. Is what we experience with is doing all that is awesome, like doing benefits. But what we've seen over 15 years is people come and go. A lot of people come and go, especially in your lower end admin tasks or assistants. And so it's hard as an office to say, hey, I'm going to give you all this, and then there's no loyalty. You know, like somebody, you offer all this stuff, and people just, hey, somebody offered me $1 more down the street. And as a business owner, it's super frustrating because we know we need to invest in our people. We know we need to offer this stuff. But then when they walk away, you're like, really? You know, I mean, 15 years, I've probably gone through for our four practices, 30 plus front desk employees, probably 40 assistants. And we have a good culture. It's just they see other jobs, so assistant wise, or assistants not so much because they have to go to school, a little bit of school. But like admin side, they can go get a job somewhere else pretty easily, get paid pretty well that we can't compete with. And so that's on our end, it's a little frustrating because we will do it. I tell people all the time, I'll pay if I have to for a good employee, man, I will pay. But then it's just like, but we want them to work and be productive and oh wait, we have to hold you accountable because you're late, or you know you've called in sick, or and then you want to leave. And so that's where on the our side where the frustration is on trying to do all that back end stuff, and then there's just seems to be no loyalty. Yes, you do get here and there, but for the most part, I mean, I have 4 original employees that are all high level leaders now in our business that were from us from the beginning, but the rest, it's brutal. And I think that's how all industries are.
I think you're right to some degree. I also feel like that can be part of the vetting process. Maybe we're not finding the right people, or we're not really vetting the right people, or communicating it as clearly as we think we are, because sometimes we do. We think we have a great culture and they're seeing something different. I also like to say, ask the team what they want. Like if you're losing people for $1, that there's something else going on usually. I assume $1 was just throwing a number out there. There may be, $5 to know. And at the end of the day, they are making a business decision for themselves and their families. And there's plenty of reasons why people leave. But time and again, for decades worth of studies, it's usually been because of leadership in some way. And oftentimes it's because of just a lack of communication, that we think we're being abundantly clear about what it is that we're expecting from you. And they come on board and there's just a mismatch somewhere. So sometimes really it is. It's the bringing on the right people. And how do we even figure out what that looks like? And it can be hard. And the second side I would say to that is that those are not the people that you want on your team. And thank you for self-selecting out.
I agree 100%. I think it's sometimes we have to have self-reflection of what we're doing inside our practice, for sure. I think that's something a good business owner should always do, but I've been in the industry, a lot of industries where people just come and go, and so like, you're right, they have to do what's good for them and their family. We're in an industry where we do a lot of females. And so husbands gets jobs, people move, and so the turnover is a real thing that happens because of, now that's changed a lot in the last 15 years, but when we first started, it was a lot of, well, my husband's going to school, or I'm going here. And so, but I think you're right. I think a lot of it's just self-reflection of saying, okay, what can we do to make it better? Because ultimately, when it comes down to it, the people that are the most loyal are the ones that are really invested. And so how do you get your employees invested in what you're doing? And that's culture and taking care of people. And so, I mean, it's just trying to convey that to them, because pay is good, but I think most people will work for less if they feel like they're valued and that they are part of something that is helping people. I'm a big believer of that. If you can show that to employees, that they're more likely to stay for a lesser amount. I mean, doesn't mean you don't pay them less, but they like the camaraderie, teamwork, all the cliche sayings, but people actually do.
100%.
Well, and if you dive deep into like the science of motivation and why people stay, like I said, ask your team. You may have heard of exit interviews, but how many practices are really conducting stay interviews? My goodness, like I said, I do employee handbooks. And so I know how many practices, when I get to that section about performance reviews or performance development check-ins or growth conferences or whatever you want to call them, where the number of practices that are like, well, we do them maybe like once a year. I'm like, that's not enough. And also, you're not really getting great information
once a year.
Oh my goodness! Once a year, we maybe sort of can we just not put an actual duration there, because we don't want to be beholden to doing it once a year. I'm like, you can't take 15-20 minutes to chat with your team members a couple times a year.
We call them check-ins.
But that takes production, and we don't have time for this. And I said, yes, but what ends up happening is people leave and we don't know why. So there's something called a stay interview that whenever, and I have this, it's a resource that I'm happy to share with anybody. I give it out for free. I've got it in several Facebook groups. I call it an alignment and accountability check-in. Alignment with the practice core values, mission, vision, values, alignment with the role, and then alignment between the leader and the team member on what is our next steps, what are our goals, and how can we help you remove barriers. And there are some questions on there that basically ask, what would you leave for? Like, why are you staying, and what would make you leave? And what can we be doing better? What can we stop, start, and continue to be better as a team and as a practice, as a leadership team, to make you feel like this is the place you want to be? Let's build a practice worth working for. You have to keep asking those questions on a regular basis from everybody, not just once a year at the performance review.
Yeah.
It's good stuff, Kara. That's great.
Kara's got a resource library second to none, you guys.
And about 40 hours of content. So,
but I have to kind of echo all of that, and I know we're coming up on our time. But one of the biggest things that I found in the communication with the employees that helped us retain employees when we had our big group policy in place was we actually worked with our payroll department to create line items on the pay stub that were specific to show them what the cost of the premiums are that were employee, what was the cost of the employee pre-tax dollars, and what was the cost of the employer. And it showed the $17,000 benefits package as part of their compensation package, so that every employee, if they were ever looking at another job, they would go, holy cow, my other job, yeah, I'm making $55,000 a year as an office manager or whatever it is, but I have a $17,000 package. I need to make sure I'm out there trying to find a job that's $72,000 or $73,000 or more in order to consider it a step up. So that helped a ton, that you can work with your payroll department to get them to itemize on the pay stubs what the employer contributions look like.
That's a good idea. That's a great idea. So yeah, we are definitely coming up on the top of the hour. I do want to be mindful to your guys' time, but I wanted to thank you. But I do have one last question. Just we'll go around the horn. You can answer this question and then just do a quick little outro for yourself as well. The question is, do you believe that your benefits could actually turn into a recruiting and retention tool as a profit center rather than a cost center?
Yes. I've seen
Way to be bold, Jake. I love it. I love it.
I've seen it. And honestly, even though I'm running a really small, lean and mean team today, it is still a focal point of our team. We have a process meeting every week for an hour, every Tuesday at 2:00. And that is the first thing on our agenda is, are your benefits working for you? Because I have 2 employees that have significant health needs in their household. And so I want to make sure that that answer stays yes with every one of their visits. And anytime that it is not, it leads me to go down the rabbit hole of what else do we need to do? Because I know that I can't grow my company without that team and without them staying happy and being so integrated and bought into our vision, that I need to make sure they're happy. So I would absolutely say yes. It's been a huge, huge thing for the retention and growth of our revenue streams for our business.
And I'd echo what Jake said. More of, I said in the beginning, your most valuable asset in any business is your people. I think some people forget in all industries, other than maybe like AI, is you're in the people business. We're all in the people business. Like that's all businesses are people business. And once you realize that you're in the people business and you're serving people and you're helping people, it changes all that. And so I think when you invest in your people, they're going to long-term, those assets are going to come back to you tenfold always. And so if you're willing to do that for them, and you do what Kara said, I love what do you not exit interviews? What do you call it, Kara?
Stay interview.
Stay interviews.
interview.
Love that, because it's important to find out what your people want and what they need, and how you're keeping them happy. Plus, it builds that trust and relationships that can be long term,
Yep.
for any business. So I think it's crucial to invest in your people, because they're the ones ultimately are going to. I can't do my business alone. Like John can't do it all. I mean, I guess you could, but that'd be a very slow practice, right, John? Assisting, answering phones, like in the clinic.
Yeah.
It would be very exhausting and burnout. So you have to invest in your people.
I would echo and say
I
that.
agree. I mean, your benefits package. Oh, go ahead, Kara.
Oh no, I think there's a bit of a lag. Go ahead.
I was going to say, yeah, it could definitely be a profit center in the practice. Your benefits package, just I mean, when you have the right people on the bus working for you, I mean, things skyrocket from there, and your benefits are part of that. Like here, I'm on vacation. I got the palm trees in the background, and I've got my team working for me at the office back in Colorado. So, I mean, they're dedicated, and I do provide those benefits, and hopefully have a great team culture as well. And so, we do have a long-term team that's been with us, but they wouldn't be busting their butts if you weren't busting it for them, so yes, your benefits can take you to that next level. I totally agree with that.
No, I would say absolutely as well. Echoing everybody that's already spoken, your turnover percentage is not a number that practices look at. Certainly not independent practices. I've even seen some corporate practices that don't. And I've gone and calculated some of the practices turnover percentages, and they're approaching call center levels, which is not good in healthcare at all.
Yep.
And how much is that really costing for every employee that you lose and have to replace? On a conservative level, it's like 20 to 30% of their first year's annual salary. So if you can show, and nobody does, but if you can show how much you're actually losing to your turnover versus how much your benefits are going to cost you, then yes, absolutely, it's a profit center. You're saving money, making money by retaining people year over year versus having to replace them every 6 months.
Yep. Love that.
Cody. Yeah. If I could chime in, I think all that's been said is absolutely correct. People really matter. That's what it's really all about. But you're spending money for those people and for those benefits. And the way we would just encourage people to look at the premium being spent on health insurance, for example, and just know that there's a better way to do this. Right now, it feels like a sunk cost, money that you spend that you'll never get back. But the way that we build these plans, when your employees use the plan better, and when you come back at the end of the year and find that you have spent less than has been collected in premium, you get that money back. So let's, again, question the status quo. There's a better way to do it. We can get some of these invested dollars to come back to the business owner. And that's something that's a great day. Anytime we can report that.
Well, and if you're talking health insurance and how is this making you money, if your team has health insurance and they can go to the doctor and actually get taken care of, they spend less time sick and less money out of their pocket. So they show up at work more and you make more money.
Absolutely. Yeah.
All right, Rhonda, bring us home.
I would echo all of that. I've thoroughly enjoyed each of you. Thanks for participating. I love to meet new people and hear what you're doing. I agree. Our people are our most valuable asset. If we don't take care of our people, we are missing the whole point. And we are nothing if we are not healthy. And so let's find a better way to bring that health to your employees in a way that costs you less.
Yep. Agreed. All right, everybody. Thanks for participating, and thanks to you guys for tuning in as well. If you guys have any suggestions on upcoming topics, we're all ears. Would love to hear it. And also, if you'd like to participate like John and Dan have, we'd love to have you guys on the panel as well. feel free to DM me. My information is in the dental school. You can DM me there, or like I said, my email's there as well. So with that being said, thanks everybody. Thanks to our panelists again. We appreciate you guys and your input. And until next time, we'll catch you later. Have a good one. Bye-bye.